Good morning. My name is Dr. Hillel Mazansky, and I specialize in medical hypnosis, guided imagery, nutrition, and exercise. My website being www.gianinc.com, standing for Guided Imagery and Nutrition.com Incorporated. On Facebook.com/guided imagery. All our previous YouTube videos are stored, plus a great deal more of medical information. We are also on Google+, on Twitter, LinkedIn, Pinterest, and the rest of the social media today. Today's case study is about obesity. I do not have to tell all of you how the incidence of obesity is increasing amongst men, women, and children. Childhood obesity, as you know, is my passion. Now, it all comes from incorrect eating habits and no exercise. If I see a patient with a BMI, body mass index, below 30, those of you who want more information about body mass index, the medical profession does not work in pounds anymore, but in BMI. And to calculate your own BMI, you're invited to hit the nutrition tab on my website, and you can see what your BMI is. Or you can just use any search engine of your choice and put in BMI, body mass index, and you will be able to calculate what your body mass index is. If a patient comes to see us for treatment of obesity, in which there are many, we use a nutritious program of eating real food, exercise, and medical hypnotherapy. The reason why we use the hypnotherapy and guided imagery, because oftentimes in the compulsive eater or those who've yo-yoed their weight up and down, there is a psychological element attached to it. So this comes out when we do a hypnosis session and when we probe the subconscious mind. I don't want to delve too much into the management of obesity because we have done case examples of that. Suffice it to say that my experience with obesity goes back over 45 years when I was in South Africa and in Cleveland. I gained somewhat of a notoriety in treating obesity. Today, there is a pantheon of different types of treatments that you can use. I mean, to the real type that is obvious, where they make special food for you and you eat 5 times a day, to the ridiculous, where you eat chocolates or one type of fruit or a vegetable and that's all you eat. That really makes no medical sense, because eventually you'll have to start eating a regular diet and regular real food. So why not start from the beginning? Today's health tip, however, is going to center around the virtual lap band surgery treatment. For those of you who do not know what a lap band is, in those patients who are really morbidly obese, weighing 300-400 pounds, they undergo a surgical technique called a lap band. It is a plastic ring that is placed on the top portion of the stomach, and the idea behind it is when a patient eats food, the stomach content is very small and can only take a small amount of food. If they try to force food and eat more, then they become nauseated, vomit, and become ill. That is the theory of doing a surgical lap band treatment. But The complications of surgical lap band treatment are many because you are dealing here with a grossly overweight individual. The chances of complications such as wound rupture, wound infection, bleeding at the wound site, a clot in the leg and a piece can come off and shoot to the lung and cause pulmonary embolism, and death can occur. While it is not uncommon, there have been cases described. But now, friends, here is the alternative. Virtual lap band surgery using deep medical hypnotherapy. In other words, having had surgical experience years gone by, we did not have the lap band, but I did do abdominal surgery, so I know exactly what they do in a lap band surgery. I hypnotize you and take you through the whole surgical process of a lap band. In other words, you hear the wheels of the gurney, you see yourself saying goodbye to your loved one as you're wheeled into the operating room, you see the bright lights, the anesthesiologist giving you the shot and you're going to sleep. But because the subconscious mind is far stronger than the conscious mind, you are able to visualize the entire surgical procedure without pain. That is amazing. After I make you visualize the band being placed around your stomach, I also am able to control your bleeding using medical hypnotherapy. And then you see yourself being sewn up, sutures being in place, and you go through the whole recovery period in the intensive care ward, etc. And all this you visualize. Now, complication-free, no side effects, no bleeding, no infection, nothing. A virtual lap band surgery. Now to my case. My case was a 70-year-old religious Jew who came to San Diego and was referred to us by a friend of his. He'd undergone a lap band surgery about 5 years ago and did extremely well. All of a sudden he noticed that he began eating again and he started gaining weight. Returning to his surgeon did some tests and found that the lap band had come loose. Surgeon said to him, "There is no way, you are too old. There's no way I'm going to redo your surgery. Just go on a diet and lose weight." And those were his exact words. The patient came to us via a friend of his in Israel who referred him to us because that friend had received our weekly health tips, and he said, "When you go there, go and see Mazansky, he'll help you." The patient was an extremely nice, erudite rabbi of great intelligence. He asked extremely important questions which were answered. I then did a medical hypnosis, virtual lap band on him, taking him through the whole procedure. When he came to, we gave him, or when he was brought back to the here and now, we gave him a comprehensive nutritional program, the first week of which he was allowed to have protein powder and oil. The reason why the oil is added is because there are two things that increase, that the satiety center in the brain responds to and does not cause hunger. And the one is carbohydrate, which we'll certainly not give, and the other is fat. And oil being an extremely important fat, we gave him that. He was given instructions to drink a lot of green tea, etc., etc. And I spoke to him every single week, because when you treat a patient with obesity and you give them a program, what is of prime importance is they need to be contacted. They need to know that somebody is taking care of them and somebody is looking after them, and they have to answer to that person. To date, the patient called me on Friday to wish me a happy Jewish New Year, which started last night, the year being 5773. And with much delight and glee in his voice, he said to me, "Hillel, you are the very, very best. I wish I came to you beforehand." He has lost 75 pounds on a virtual lap band surgery combined with nutrition and exercise. My name is Dr. Hillel Mazansky, and I thank you for listening to this video.